Hello and welcome to Alternative to Meds podcast. This is Debbie Nelson, and I'm pleased to introduce Dr. Alice Lee. Hello, Dr. Lee.
Hi, thank you for having me.
We are on a similar mission, and when I find people that are like you, we get very excited because to find integrative psychiatrists are rare, let alone somebody who serves adolescents. Is even more difficult to find. So when we find someone of your caliber, it's wonderful to expose your work and what you do. So tell us a little bit about you and how your road into integrative psychiatry started.
Well, it's a very long journey. I started back in 2002 using supplements, just one supplement. And I was thinking that's all I really needed to know. This one supplement, I was going to just use this multivitamin that was at the time being used for bipolar patients. I was going to use that, and that was my whole kind of holistic approach. Over time, of course, I had to learn more about what that meant, what even using a supplement meant, that it was taking me down a holistic path. At the time, back in 2002, when I first started, I was just using it to try to help the sickest patients who weren't getting better on medications. And then in 2003, I ran across someone who worked for a mobile treatment unit. One of my patients was actually too sick to come to my office, so I was looking for some support for her. And Mark Botnick, who is an energy therapist, he's a social worker, but he did a lot of energy work. And he'd been doing it for about I don't remember whether it was 5 or 8 years before I met him. And so he taught me emotional freedom technique. And I started learning that in 2003. He also taught me, or at least he introduced to me, the idea of muscle testing. I call it energy testing because it's not really so much the muscles as it is about intention and our connection to energy fields and our ability to sense what is true and false with our innate ability to tap into information. And so I started learning about energy testing. I started to use that to help me know whether the patient needed more or less of this one supplement I was using, because the company that was making it kept asking the patients to take more, because obviously they make a profit when they sell more of the supplements. But I was wondering in my mind whether they needed less at a certain point. And it turned out with the muscle testing, I was able to use that kind of testing to help determine whether the patient needed more or less of those supplements. And that was how I started off in terms of learning about some of the ways in which I could use testing or energy testing to access information for my patients individually on an ongoing basis. So these three things, the energy testing, the energy techniques, and the supplements were the very early foundations of my approach to holistic medicine. But my journey actually began much earlier than that, because the only way that I was even open to using a supplement for my patient was because I had started using a supplement myself a little earlier. I think it was back in probably 1998 or so, 1999. At that time, my husband at the time was starting to get into supplements and nutritional health and things like that. And he noticed that I was often very tired, especially after meals. And so he recommended a supplement that had chromium in it. And after I started using that, it was the very first time that I actually used a multivitamin myself. And it really helped me with postprandial sedation. It helped me to normalize my blood sugars because I had gestational diabetes with my second child. And so my blood sugars were probably not well controlled in 1996, but it was getting worse and worse over time. So I was having some personal experience with supplements that was really helpful. Another piece of the puzzle was in 1996, actually, it was in 1992, actually. In 1992, about a year after my daughter was born, I'd been in the adult psychiatry program, residency program at the University of Maryland for over 2 years. And during those 2 years, I'd been working on the inpatient psychiatric units, most of them in VA hospitals. And it was really my first real exposure to the psychiatry field, because a lot of times up until then, you just kind of anticipate what it would be like to be a psychiatrist. But then once I got into the residency program and I was working in the actual field, I really didn't like the nature of my work. I liked helping people, but I really didn't like what it was that I was doing. I saw a lot of chronically ill patients, and I didn't particularly like the environment that I was in. So a lot of the residents were in what we call training psychotherapy. So we had our psychotherapists who were also, they were mentors. They were people who were there to kind of help you to deal with things in a therapeutic way. But at the same time, you were supposed to learn from that experience and be a better doctor. So my psychiatrist at that time, who was my therapist and my mentor, I told him that I wasn't happy and I wanted to quit psychiatry. And the long and short of it was, I told him that I was so unhappy, I was suicidal. I don't think I was seriously suicidal, but it just felt like I was dying in the inpatient unit. And so he put me on Zoloft. He thought I was depressed. And I felt much better on the Zoloft. It was about 25 milligrams. And I was left on that Zoloft for about 5 years without, anybody really thinking about taking me off of it. So by the time 5 years had passed, so 1992 to 1997, this is like a year after my second child was born, I said, I really don't want to be taking this forever, because normally I don't even take an aspirin for a headache. Why should I be on a medication for the rest of my life? So I stopped it after taking it for about 5 years. And within about a month, I was definitely depressed, suicidally depressed. I was almost catatonic on the sofa on the weekends. And so then my husband at the time asked me to get back on the medication. I took the medication again, and within a few days, I felt better and was more balanced. And this went on back and forth for me for a while, wanting to come off and finding that I would be hit with a ton of bricks with this kind of weird, incredible depression that I'd never felt before. And then getting back on the medication, and it would just kind of vanish after a few days. And we hadn't really been schooled in terms of medication withdrawal. So I wasn't really clear initially what it was that I was experiencing. I was of the mindset that most psychiatrists would have had at that time, which was it was my old depression coming back, but it felt really different. The first time when I was put on Zoloft, it was because of an existential kind of crisis in my life. I really did want to go back to my original interest in my life, which was to be a writer. And I wanted to pursue that in a creative way. It wasn't really like I was depressed in a physical way, but this felt really physically oriented. And so after this kind of back and forth for a while, I realized that this experience that I was having with this medication felt very much like a drug addiction. Like, it wasn't like I was craving the medication, but I was experiencing the opposite of what that medication was supposedly treating. So when I thought of myself being dependent on a medication, it really stirred up a reaction. And it was the first time that I actually had that reaction. And that was this desire to combat it, to face it, to overcome it. And I think the whole process of being put on a medication, to understand what it's like to be on a medication, to feel the impact of a medication withdrawal, and to be able to then try to search for a good way to address it, was my path. Because there's no way that I could have switch from a conventional psychiatry perspective to a true holistic approach if I hadn't empathized with what patients go through when they're trying to get off a medication. So
I think that's what makes you such a powerful healer or a doctor, is when someone has actually experienced it. Like, you're speaking on a firsthand basis, and so many psychiatrists don't even acknowledge withdrawal symptoms oftentimes, or acknowledge that the body acclimates to these medications, and when you come off of them, there is going to be an aftermath. So it's very powerful to hear a personal story on that. That's a psychiatrist and your journey. It's amazing. Yeah, so go ahead, continue. Yeah. I love it.
Thank you. I just think that our paths are meant to be educational for ourselves in a way that makes sense. And each step of the way, I was learning something valuable that I can carry with me, even though at the time it didn't feel good at all. But I learned the value of not being dependent on a medication. And now remember that I was just on 25 milligrams of Zoloft, which is almost nothing compared to most of my patients who are coming in with 100 milligrams of Zoloft and other medications in addition to that. So I was able to, get off the Zoloft and not take it by just taking some St. John's wort and a little bit of ginkgo biloba, which is what I knew at the time. And that was, I think, like I said, it was in 1997. So by 2002, that's another 5 years. And during those 5 years, I really didn't feel completely well. It wasn't until in 2002 when I started taking the same supplements that I was using to treat my bipolar patients that I really felt that big shift for me. I felt completely well. My mood was finally back to what I would consider my normal. And I also learned that from using that particular supplement, because I could tell by giving patients too much of the supplement, sometimes it will have side effects. Sometimes they will have their old symptoms come back. I knew that when I started taking that particular supplement, I was taking doses that these bipolar patients were recommended. And I felt well immediately, but then after about a week or two, I remembered that I couldn't sleep very well at night. It was almost like I was too revved up. So I had to come down on the supplement. So all of these things helped kind of lay a foundation. And, I've been through a lot of stress since, 2002. It's been 17 years and I've gone through a lot of different experiences, but I've never been depressed. So that teaches me that what I had gone through at that time was a physiological experience. It wasn't that there was something innately wrong with me personally, that once I physically recovered from whatever was going on with the withdrawal, and continued to strengthen myself with the supplements that are helpful for my stress resilience, I would not have that vulnerability, that depression again. So that's helped me to move forward and hang in there with patients and continue to work with integrating tools as I learned them through either textbooks or conferences or through my energy testing. I soon developed a novel way of testing too, which taught me a lot. So when we do energy testing, some people call it muscle testing or applied kinesiology, we start to learn how to access information about what's true, what's false about information. And as a psychiatrist, what I really wanted to do was access accurate information that was about my patient's functional data gradually over time. And so what I created over time, starting in 2003, was a way to do that. It's a way to quantify and be much more specific and accurate about my testing. So rather than whether a person is having withdrawal or not having withdrawal, I developed scales that measured how that person is doing in terms of their medications, whether they're ready to lower their medications, whether they're having allergic reactions to their medications or hypersensitivity reaction to their medications, as well as many, many scales that measure that particular patient's biological functioning, things that normally a functional doctor would need to use lab work for, such as the microbiome or neurotransmitters or toxicity or infections. I could start doing that through muscle testing and these scales I was creating. So in those early years, let's say from 2003 to about 2000 and I don't know, like add another 6 years of 2009, I was always constantly adding to this template, a template made out of many, many scales that measure many, many different aspects of physiology and function. And it really cut down the cost for my patients. In the beginning, I was doing some lab work and testing, but now I almost exclusively use the energy testing to access functional data. And I can do that in the office with the patient present. I can do it while the patient is in a different location. And I can advise people very quickly about what they need to do with their medications or their supplements using this approach. And over, I guess, 16 years that I've been using this, it has helped me tremendously to access information and be able to direct treatment in a way that lab work couldn't do.
So, Dr. Lee, I know, like for the layman that's out there, for myself, I understand energy and kinesiology and what you're talking about. But if someone were to do this, kind of, if you can explain to someone what exactly does it mean when you're saying you do muscle testing?
Okay. It is a difficult concept for most people to wrap their minds around because energy medicine is all about energy and about how our mind and our thoughts are connected to our physical functioning and to energy fields. So it's more of an Eastern approach, beginning with what we know about chakras and meridians, about meditation and its impact on our health and well-being. But the energy testing is, there's one way to think about it. There is actually machines that do energy testing. They're bioscan machines, and a lot of the chiropractors and naturopathic doctors have them. You go to their office and you hold these metal rods and it runs electrical current through your body and it reads the meridians and chakras, and it can spew out a lot of data about what is going on in your body functionally. The kind of energy testing that I'm doing is allowing the actual body, which is a instrument and it is also energetically attuned, to be able to tap into energy fields which hold information. And we all can do that. We can actually access, we're always connected anyways, to information and energy fields. So the only thing that the patients and the clinician is doing is linking that connection to a feedback mechanism. So a lot of clinicians will link it to a mechanical feedback mechanism that has to do with how the muscles function, whether the muscle tone is strong or weak, or whether it shifts from one way of behaving versus a different way. So what I did was I just simply linked energy fields to this biomechanical feedback mechanism that accurately told me whether something is true or false. And we all have that innate ability to have a slight shift in our energy when we're thinking of something true versus something that's false. And this is an aspect of our innate biology, our innate energy, that is possible. And I show it and then demonstrate it to my patients so that my patients can see how they also have that innate ability. So one of the tricks that not trick, but a game that I play with my patients is I will show them that their arm would be strong when they're saying 2 + 2 is 4, but it will go weak in terms of muscle tone when they think 2 + 2 or say 2 + 2 is 6. And then what I say, to them is, so now you can sense the difference between a true response and a false response. But now I'm going to say 3 things to you that's either true or false, but I'm going to say it in Chinese. And I'll ask them, do you know Chinese? And most of them don't know Chinese. And then I'll say 3 things in Chinese that I've already written down on a sticky pad. And then I said, I don't want you to be psychic. I just want you to listen. And after I say it, I want you to just hold out your arm and be as strong as you can with all 3 trials. And let me know at the end, which of the 3 would you say are true and which of them are false? And usually they'll have weak, strong, weak. And so I'll say, well, if you had to bet $10 about which ones are true and which ones are false, what would you say? And they would say, well, it seems like the first one is false, the second one is true, and the last one is false. And then I would show them that I had read something I'd already written on a sticky pad, which is this. And I would say, take a look at that. And I'll say, that's what I said in Chinese. And every one of them would be like so shocked and surprised. And I just teach them, I said, we all have this innate ability to be able to sense what is true and false. And all we're doing is we're testing you to show you like there's a biomechanical shift in your body when you are connected to true information versus false information. And I'm just using this as a trained clinician in a way that's much faster and much more emotionally detached, meaning like I'm not affecting my testing with an emotion that would skew the testing in any way. So I can control, how the testing works because I don't affect the testing by assumptions and I don't affect the testing by my desires of what I want the answers to be. So that's how I try to teach my patients that we all have that and that our body speaks in vibration as well as biochemistry. And we understand the biochemistry piece, but it's harder for my patients and even for me earlier on to understand how the body speaks in vibration and how we can take advantage of that to access information and also to shift energy. And so I try to teach my patients in my office that I can shift the energy. I can visualize that positive energy flowing to you. But if you're skeptical and you're blocked, it won't happen. And if you're open, you'll receive that energy. So we use energy testing, or you could call it muscle testing, to demonstrate these effects. Like I'll say, I'm going to just visualize good energy being sent to you. And you can just have this skeptical scientist attitude, meaning that you don't see it, so it's not there. And we'll test how strong you are when I'm sending you energy when you have that attitude. And they'll be, baseline. And then I'll say, okay, now you don't have to believe it, but just say if there's good energy flowing to me, I'm going to be open to it. And then just hold your arm for as long as you can. And then as I send that energy to them and they hold their arm out, they're able to sustain the strength for they just don't get tired when that energy is flowing through. And so they can sense the way energy affects their physical body through testing.
Right. Well, I think, and using this in psychiatry, like you're saying that you're doing this testing to be able to access whether or not someone, for instance, to do a taper or what supplements would work for them or whether or not they're ready for that or whether or not it's going to be an effective supplement. I can see where that would be a very valuable tool. And it's something that not traditional psychiatrists obviously do. But
take care, though, to do these kind of testing, because I learned earlier on that it's very important to define what it is that we're testing. Because the more specific you are in defining what the question is trying to access information about, the more accurate the information will be.
So I know I think there's a growing, we talk about when, for instance, Prozac, and you were talking about Zoloft and various drugs came out on the market and started to become more mainstream, like 30 years ago, all of a sudden we started seeing the ads pop up for, if you have an imbalance. And there's definitely a place. There's some people that Undoubtedly, like you said, that medication has its place, but what we found is that long term, most people are like you, where they're desperately seeking other alternatives, or they're like, hey, I don't want to be on this the rest of my life, or like you are on a very low dose. Frequently, people are on 10 different medications because their body becomes acclimated and they put them on this and that and other things. There's a growing amount of children that have been medicated now and now are into early adulthood, and an alarming number of people that, they didn't know anything different. They were just doing what their doctors were advising them. And they're all of a sudden in this crisis as to what to do and where to go. Because, and I firmly believe that if we all started recognizing an integrative approach, we would see so many more people heal and so many less people. So we'd step back off of the medication and start recognizing that there's far more effective ways to be able to treat people and heal people. Because like you said, there was a difference between a physical depression, like a truly, whether or not it's symptomatic of trauma, of what somebody's going through in their life. There's so many different things that contribute to people having depression issues. So finding integrative approaches, but in particular children, is you see adults as well in your practice. But there's such a growing explosion of children now that are on these drugs. And so when the families do find you, you're using these approaches, and are you transferring them over into various forms of the supplements, even as children? I mean, are you finding this to be highly effective with the children as well?
Oh, yeah. I mean, children especially heal the fastest. Some children are very sensitive and they can feel the energy and they love it. What I want to say about medications is that nowadays, because we have so many wonderful nutritional companies and they know about the biochemistry of the body, and they're creating nutritional supplements that provide such targeted supports for the body, that if you really knew about all the resources out there and familiarized with all the tools that are available that are natural for the body, I think that most clinicians would have they would be more empowered to help with all of these different diagnostic labels and disorders than they would just with the medications alone. So it's almost as if, to me, in my mind, if a doctor who really is familiar with these supplements were to just approach patients who have an initial onset of these disorders, if they approach them with these nutritional supplements, I don't see why most of them couldn't be healed naturally. What I found earlier in my work is that patients divided into two groups. The patients who had never been exposed to medications healed well, and they went on to be able to lower their supplements and move on with their lives. It's the patients who were exposed to medications where the healing becomes a lot more complicated, because you have to deal with medication withdrawal. And medication withdrawal affects very specific receptors, and therefore you have to actually know exactly which receptors to support in order to help someone get off those medications. And these medications may not, just because these medications have been researched in terms of, let's say, 10 different receptors, doesn't mean that it doesn't affect 20 others, So
Right.
I think that these medications, we can do our best to help people ease off of them. But nowadays, I think of medications as a buffering system. They block reuptake of certain neurotransmitters. They block this, they block that. And so what I think they do is really block the message. They block a message that is created by the underlying crisis, which are sometimes enzyme issues, toxicity issues, infection issues, whatever they are, metabolites that aren't being cleared properly. So they block them, and it buys us clinicians some time. And it allows the patient to maybe start eating, sleeping, breathing, those kind of things. And then as they start to eat and they start to drink water again, you can start to give them the nutritional supports to help them really support the body. But all of these medications, because they're so refined, they're xenobiotics. The body treats them as an additional toxin. And most of my patients are already highly toxic. So to add another xenobiotic that's not really natural to the body just puts a little bit more stress onto the body, even though side effects might be very conducive for that particular patient. But the immune system will start to become even more activated in terms of its work on attacking that medication. The liver or kidneys will have to work harder to metabolize and clear that medication. So it does create for the patient a problem later on down the road. And therefore, it's important that doctors know that, because most doctors really don't understand medications. They don't understand the consequences down the road of having a person on a medication for a long period of time. So
I think we find a tremendous amount of doctors that people will even hear that there is no correlation between diet and the brain, which is absolutely shocking in this day and age that we have that frequently told, that there's no direct connection. And so people actually believe the brain is different than anything else in their body. And it doesn't matter how they've, whether or not they're living off of Diet Coke, they eat poorly, that it doesn't have anything to do with innately how their mood is and what's going on with them, and whether or not they have anxiety issues or depression issues, that there is still a large percentage of the modern world that thinks there's no correlation between nutrition and mental health. And the truth is it's no different than any other organ in our body. The long-term effect when people aren't eating properly and not feeding their children properly are catastrophic. And I think in this day and age, we have so many people that aren't even eating whole foods. They don't even know what proper nutrition is and what that really looks like. So that's where supplementation, like you said, initially it's like we're giving a therapeutic dose of a supplement that really is just nutrients.
Well, I don't think of mental illness as isolated to the mind anyways. I mean, I think of the mental illness as a metabolic disorder, and it is affecting the whole body. But I do think that the medical field does have a myopic view of how to heal people, and that is everything has to be a medication. If you have a nutritional deficiency, you can see at the end of the article that they're going to try to find a medication to replace that nutritional deficiency, which is, to me, really a strange way to think. But that's how medicine thinks nowadays. Everything has to be a pharmaceutical pill. But I also feel like I'm susceptible to that way of thinking still. Like, for example, I had a patient who came in who was trying to get off Cymbalta. He had irritable bowel syndrome. So he was on a particular medication called Balsalazide, which I looked up and I learned about, and I knew was kind of like a aspirin-like pill. So he was not doing well on the Balsalazide. So I just kind of gradually lowered it, and he did better off the Balsalazide. But, 2-3 months after he stopped the Balsalazide, he was starting to have more irritable bowel syndrome, more, inflammatory reactions to foods. And we kept, thinking it was a neurotransmitter problem with Cymbalta. Now, with Cymbalta, I've had a lot of experience helping people get off Cymbalta. And, I knew how to protect people's neurotransmitters and work with that. So it was always very puzzling, why he was having more difficulty with his mood and with his bowels as we were, getting him off the Cymbalta. Until one day, it dawned on me that I was treating the Balsalazide the same way that a novice doctor would treat Cymbalta. Like, if I were a brand new doctor and I was trying to help people get off Cymbalta, I would just kind of gradually lower their dosage. And then afterwards, I would think it's over. And that's what I was treating Balsalazide as. I was thinking that, okay, we'll just kind of gradually wean you off the Balsalazide. It's an aspirin. So You don't need to have, need to worry about that. But it dawned on me that that's not the case. Every medication, it doesn't matter if it's for the gut or for the brain or for the heart or for something else, every medication has its withdrawal side effects. And until you really know that medication inside and out and know how to protect that person, both in terms of the properties of that medication, you are putting that patient at risk for long-term withdrawal side effects, even though we're not taught that would happen. So I was quite sure that his problem with increasing irritable bowel was due to withdrawal symptoms from the valsalazide, not just that he had irritable bowel before. It was really because of some withdrawal side effects.
That's interesting because that's true. I never really thought, but truthfully, no matter what medication that we're talking about, what is it, the root cause and what needs to be healed in order to have a person have success coming off of a medication. And so often we find, it's related to the gut. There's so many, like you said, there's all these other attributes. Like you said, the whole body is involved when it comes to healing a person when we're talking about this. And so if we're just saying one aspect, it's like you said, it wouldn't be that simple as to say, well, I'm going to take you off. We're done. So I think what's wonderful is hearing your approach. I had read about you. I've talked to you several times. I think having someone that's out there actually on the front lines and helping adolescents in an integrative approach is so desperately needed in this day and age. We have, like I said, this growing population of people who said, well, I did what my doctor said, and now I've got even more problems, and they're not sure where then to go. So an integrative approach isn't negating medicine. It's simply saying what other modalities need to be employed in order to help a person heal. And I applaud your work. It's just wonderful. And you're going to be releasing, you said, your own book shortly, correct?
Well, I am working on a book. It seems like quite a few people are interested in the topic of my journey in healing. And I thought that was a good way to introduce a lot of the things that I've learned along the way that can be very helpful for other people. So I wanted to write a book about how I gradually learned and shifted from kind of a regular conventional psychiatry perspective to what I'm doing now as a holistic psychiatrist who integrates both energy medicine as well as functional medicine. And my journey allows me to teach things one step at a time in this book. So that's what I'm working on is that theme. And the other way that I've been kind of enjoying my creative side and the writing along the way and giving myself practice is my newsletter. So it's not really a newsletter like something new, but it's always something that has to do with holistic psychiatry that I'm reflecting on. And that comes out once a week on Tuesdays. So these weekly newsletters deal with energy medicine. They deal with supplements. They deal with lots of different ways in which we connect our mind with our bodies. So,
and we'll have that linked to your interviews. So then that way people that are seeking information and would like to join your newsletter can certainly join on and hear what you're doing and what's going on, and how they can get more information about your work, along with, your practice. You're located on the East Coast, obviously. We have people that are all over the world, obviously, that come to us that are seeking integrative approaches. And the goal is to keep networking and having individuals have a network of people that they can go to and find in all over the world as to what they're doing. And it's wonderful to connect with someone who's doing such a great job, especially when you're working with children. You need to come out to Sedona soon. we need to get you out here to Sedona. So thank you so much for taking the time and sharing your story and your work, because your work is amazing, and what you're doing with adults and children is so desperately needed. And those that are out on the East Coast certainly can access you. Do you do telemedicine also?
Yeah, sometimes I do it because they don't have any other options, and I know I
Okay.
can help them. I'm helping someone in Iowa. I help someone. I'm helping another person who's in Oregon. So these are people who don't really have any other options, and I'm trying my best to support them. Of course, long distance is not as good as face to face, but it's very difficult for some people to be able to travel here. And
Right.
so I do try to help people as much as I can. There are some people who try to get help through email, but I just try not to give any medical information by email. So
No. And that's, when I say telemedicine, it's usually done on this type of form where someone can Skype or Zoom with you, where, you have a rapport, and obviously it's on a case by case where you have to decide whether that's someone that you'd be able to help. But it's certainly out there that's an option for those that, would like to be able to be in contact with Dr. Lee and be able to find out more about her practice and how she helps people and all of her integrative approaches. We'll have your website below, so it has all of your information about your practice and how to get in contact with you. So thank you so much for taking the time to do this interview today, and I applaud your work. I'm a huge fan of you. I often send it, adolescents your way, just because there's so many parents nowadays that are desperately seeking alternative solutions and integrative and functional medicine approaches for mental health. And I would say that you're one of the top people in the country that are dealing with that in an adolescent capacity, and an adult also. So either way, so thank you so much for taking the time to do this interview with us.
well, thank you, and I really appreciate your center too. I think it's really valuable. I wish there was a alternative to med center in every state in the country.
With any luck, we're going to get there. That's the goal. And, if it has anything to do with me, we're going to move that, because it's definitely a growing demographic of people that are seeking these approaches to get better, to find solutions for mental health.
Yeah,
So,
have you thought about having an alternative to med center in Gaithersburg, Maryland?
You know what? We do need one East Coast, West Coast, but the truth is we have people from all over the world that come to us. So the goal is that, yes, we'll expand. I mean, this problem is not getting less, it's getting larger. So the goal, like I said, is we will network and fan out, and we will start creating a network of individuals that have the same mentality when it comes to healing individuals and being able to help find solutions. And our psychiatrists, so they are very familiar. I mean, that's what's important, is when you're seeing a psychiatrist who actually understands what these medications are. That's very important. I mean, just to go and seek out a normal doctor and say, hey, help me get off of, or help my child, or help me get off of these medications, they really need to understand the magnitude of what they're dealing with. Like you said, I mean, that's probably one of the largest problems that I will see frequently, is that people will just stop taking medication, like what you've done, and you were on a very low dose, but they'll just overnight decide, I don't like how I feel, I'm going to take myself off, and not be properly informed as to what these withdrawals look like and what they materialize at in their body and what's going on in them, and that they have to go through a healing process in order to have success.
Right.
It's not just as simple as just tapering.
Some questions that come up a lot is how long will these withdrawals last? Like, they'll stop the medication and then they just try to cold knuckle it and hope that it'll just disappear. And I have to remind them that those symptoms are signs of the body struggling, and that there are organ systems that are not functioning very well without those medications. So when the GI system, for example, isn't functioning well, there's a domino effect that undermines your health. And it doesn't necessarily stop just because, you stop taking the medication.
Well, I use the analogy, and I've said this in many other interviews, and I say this to people all the time. This is unlike anything else. So if I went and I broke my leg and had a catastrophic injury on my leg, no one would say, just go lay down on the couch and you'll get better. You'll get better, but you may never walk or run again. And so we've introduced things into the body that we need to do certain therapeutic things in order to have the optimum success to get better. And, some things are nutritional, some are therapeutic. There's so many different aspects, like you said, to having a person get well again. But we would never just say it's as simple as taking yourself off of this medication slowly, because generally speaking, there was something that caused this to begin with. And, now it's further down the road, the body is even more dependent on this medication to produce that. And so there's kind of, I always say it's a boot camp that you need to be able to go through in order to retrain. And it's no different than going back to the gym again after being out of shape for years. There's a process that has to be done in all different ways. And, it doesn't happen overnight. But when it does, it's a beautiful thing. And most people, like myself, like yourself, have their own personal story as to why we do this work. And, that's why I'm involved with this, is because I have a passion for seeing people actually get well. I want to see them find these other therapeutic approaches that are highly effective. And there's not just one avenue. There's so many different avenues. So whatever feels right to you. But thank you so much. Your work is amazing. What you do is amazing. You're a huge resource for people for adolescent care who are needing, help with their children, seeking alternative and integrative and functional medicine solutions. Again, you're on the East Coast, but with any luck, we'll be opening soon.
That would be great. Yeah.
Yes. You know what? There's such a need. There really is. Thank you so much for taking the time, Alice. And like I said, all of Dr. Lee's information will be below. So it will have, her website, all of her information, her newsletter. So if you want to join on to her newsletter and get just insight as to what she's doing every single week and how she's treating people, those are all resources that will be readily available and attached to this. So thank you, Alice.
Thank you,
Dr. Lee.
Thank you so much.
Thanks.